effective to develop immunity through being given a vaccination. What I've heard is that when people that I've seen, because I've seen people getting COVID twice, the window period is anywhere between 6 to 10 weeks. And I'd like to hear the experience of my colleagues here. This is people who've got COVID, without vaccine.
Yeah.
From what I'm hearing, though, is that the vaccine provides a level of immunity up to about 6 months. But nobody, I think, at this point in time can guarantee anything longer than that. But I'd like to hear what my colleagues say.
Yeah, Dr. Sally, what do you say? Go on.
So just not to stay too far away from the question, just repeat the question, because I did move on to...
Okay.
Just repeat the question as was asked from the viewer.
Yes, the question was, for instance, let's say myself, I got COVID last year, July, right?
Yeah.
And then I passed through it and I recovered and all that stuff. So, 9 months, 10 months later, do I have to take the vaccine because I've had COVID already?
Yeah, so when you get your first COVID, when you get your the first disease, let's call it, you do passively get antibodies, and then there are 2 ways your body builds up the immune system. So once you have recovered fully, what we did find, as in how much time you are immune, it went up to about probably 3-4 months. And the reinfections, at least in Spain, were not as frequent as they weren't very often. We did have a woman who got reinfected and did have a worse version of the disease, but reinfections weren't that common. But you should get the vaccine because of variants. So your natural immunity won't be able to defend you much longer. That's what we know. And the vaccine for now, at least from where we're using Israel and the UK, has given immunity for at least 3-4 weeks. As the months don't pass, we won't be able to know how long. But I just want to say something positive in the light of reinfections, and if we do have immunity, there's always a chance, and we're working on trials, to give the booster doses for all those variants that the vaccine we have received might not be effective. So we shouldn't think that, why should I take this vaccine? Because there'll be a variant and it's not effective. Absolutely, that is not true. Booster doses will be possible. We cannot say how long the vaccine will give us immunity until we see the effects right now. So it's work in progress. So it's very difficult for us to evaluate that. Natural immunity was seen didn't last as long as we would have wanted to. Past 3 months, 4 months, we realized that patients were prone. And yet again, you can be prone to, as what has happened in Europe, you can be prone to a new variant, which is more aggressive. So you must get the vaccine because of the chance that your natural immunity, and can be seen in Europe, is not going to defend you, is not going to protect you for a very long time.
All right.
And just a quick, Jeff, if I could just quickly mention 2 things that are important, because people have asked, when you get your first dose of the vaccine, remember you must keep all the protocols in place, at least for 14 days. From 12 to 14 days, you have 0 immunity. So getting the vaccine today doesn't mean the next day I can, start meeting people. It's very important to understand that even after 14 days, you're still not very protected, but you've started building up. So many people might take the vaccine and then feel that they're protected, but you really must wait until maybe past 35 days you started having a very strong, so you keep waiting. And it has been shown the AstraZeneca will protect you even past those 8 weeks, because even the UK were trying to evaluate a single dose to see, so that as many people as possible could get vaccinated. So yes, to answer the question, you should get your vaccine, because this gives you better and more robust let's say, defense mechanism towards hospitalization and death. So let's just keep remembering the problem here is hospitalization and death. So if you do get COVID after your vaccination, it'll be very mild, and we can probably reduce it to the importance of a flu.
All right, got that. Okay, Dr. Kim,
can I make a small comment?
Yes,
there,
go ahead, Dr. Kim.
And those are very valid points. But just to reiterate, the vaccine protects you. It doesn't protect the next person. You're still infectious even though you've had the vaccine. So that's the one thing. The concept of herd immunity is also a discussion that can be held on a different day, because ultimately the more people who are vaccinated, the less likelihood that they can actually contract COVID.
Absolutely. Yeah, it makes sense. How about this one, Dr. Kim? On you still, since there's a new strain of COVID-19 and the version of the spike protein used by the vaccine was designed to match that of the old virus, does that mean the vaccine will not be effective in, say, a year's time? Valid question.
I actually don't believe so. My colleague who spoke just before me talked about variants, and we are definitely going to come up with different variants, and we need to be geared towards understanding and accepting that we'll have to re-engineer various vaccines. I think one of the issues around vaccines and how vaccines are developed is, do you either use a live version of the antigen, or do you use an engineered version of the antigen to create the vaccine? And I think that's a very important differentiation that, not in this particular forum, that needs to be, understood. Because the effectiveness rather of the vaccines could be closely associated with how the vaccine is actually engineered and developed. So, yeah, maybe I'd actually like to hear what her views are.